Youth experiencing homelessness was an issue before the pandemic, which, according to a new study, has gotten worse these past couple of years. Advocates say young people need a specific strategy to exit the homeless system.
A lot of the places that young people were able to get together were no longer available or had to work very differently, including the organization they work for. So I'm not trying to throw blame at everybody, but it's very challenging. And I think the youth didn't necessarily get all the support that they needed.
Julian Diego is a creative director at Sketch, a community arts initiative which involves youth experiencing homelessness in art projects. He was formerly a case manager at a youth shelter. Diego says shelters are simply a part of the solution.
Shelters don't build houses, right? They don't necessarily provide employment for people. They can't challenge rent control. They can't go after a bad landlord. But I think it's a little unfair to look at them and expect that they can. It's like asking a hospital to prevent illness. Like, they're not really positioned to do that.
A new study done in partnership with the University of Toronto, which took place during the second and third wave of the pandemic, found the city's homelessness system is currently structured to respond to emergency situations. It took a look at 4 emergency shelters in downtown Toronto and interviewed 45 young people, 31 staff, as well as surveyed 71 young people and 93 staff. One youth participant wrote, "I'm just living day by day at this point. That's what makes me feel like I'm a shelter kid, and I hate that. I feel like I'm in a revolving door, and COVID definitely made it spin a lot faster." The lead researcher of the new study, Amanda Noble, says investing in a youth-specific approach would help prevent the reliance on shelters and lead to better outcomes for youth.
Acknowledging their unique developmental needs and developing a strategy to meet them. The next thing would be to put a lot more resources into prevention. So that might mean providing supports to families, which may be clinical supports. It could be connecting them to resources. It could be helping young people who are at risk of experiencing homelessness stay engaged in school, help support them with affordable housing and social inclusion.
The study also found that local agencies and the government should focus on providing support services that help keep youth in their homes or with other family members whenever possible. For City News, I'm Maleeha Sheikh.